Hi, it's Annie with Sensing Vitality. If you are looking for self-help for a herniated disc or for disc issues in your lower back, if you're looking for self-help for tractioning your back, for tractioning your neck, this lesson, based on the Feldenkrais Method and the work I do with nature healing, how we can learn from nature, will help so much. It's a lesson I use a lot with my clients. And you're going to need a skinny blanket roll, and that is taking a blanket in half and making it very long and thin. And we're going to lie on this. And you've probably seen all kinds of things you can buy to lie on, to open the back. And those things are nice. This is a blanket, so it's softer than like a hard foam roll. And you can also use a towel. All right, we're going to make this roll and then go lie on the floor on a rug. I have a thin mat there, but it's best on a hard surface. Even though you may be a little uncomfortable, try doing this on a hard surface. If you are in excruciating pain, don't do this quite yet. Actually, do some of my healing rest lessons first. And then when the pain is a little bit less, then come back to do this lesson. This is not for the acute situation without a professional helping you. It's easy to pinch things more, and you want to work very gently without urgency when you have a lot of pain in the back. Now, breathing is going to be very important, and pacing yourself, that you go slowly and gently so you do not hurt yourself. That's the whole point. And we want to lengthen the spine but align the spine. So if you just simply traction without aligning your back, it goes right back to where it was. And that's probably what you've experienced with a lot of other exercises. But this work that I do helps you feel the alignment, and it will tend to stay much longer. You will need to repeat this quite a few times to start to slowly build this sense of core and balanced core. And I have a whole series of lessons with these. This is just a short introduction. So let's get started. Get your blanket roll and let's head to the floor. All right, so you're going to be on the floor with your blanket roll. I have a longer version of this on my Patreon, but this is just to get you started. So you're going to lie with your chest and your pubic bone on the roll, and your throat and a head is going to be off the roll. If this is too pokey for you, then either double it by adding another towel, or you can even lay a pillow over the top of it. The point of this, though, is to really have you sense the midline of the front of your body. And we're going to be gently working with your feet, and so you may either want your socks on or off. You don't want to be too slippery with your feet. If you need to, you can even have shoes if you need for traction. But let's go ahead and get started. So you'll get onto your hands and knees, and then just gently you can either slide your knees back or one knee at a time, or use your arms to come onto your chest. And the blanket roll is between your legs here. Your legs are spread but not too far apart. And you're going to take your right hand on the bottom, palm down, left hand on top of the right, and place your forehead on your hands. All right, it's very simple. You're going to gently have your toes so they're tucked under for pushing. And generally, you want to do very little here. So just to get you prepared for doing little, take a breath in, inhale, exhale, and see if you can just settle into the floor. And do that one more time. Try to breathe in. And in the Feldenkrais Method, we feel for the bones.
So sense the bones. You probably feel the pubic bone, maybe your elbows, maybe your forehead, and adjust your head, and you can kind of roll it a little on your hands, move your elbows as you need so that you can settle your chest a little bit more into the blanket roll. All right? It's important that you do this because this is going to help you with finding the core, yeah? And you have some habits probably of things being a little misaligned. Now, let's go ahead and straighten your right leg. So you lift the knee off the floor. The toes are tucked under for pushing. That knee is straight. Yeah. And then keeping the knee straight, you're going to push it upward in the direction of your head. Not toward the ceiling, but upward, like it's a cue stick for pool, yeah? Playing billiards. And you gently just slide in the air the straight leg, and you're going to find that's going to pivot a little bit on the pubic bone. Don't move very far, okay? Especially if you have discomfort in your pelvis or your lumbar spine. Just make a small movement and then take the heel a little bit backward, okay? And then rest. Put your tops of your legs back down and just rest like this in this position. And if you are really uncomfortable in this position, you can rest with one knee up, slide one leg up. That's all right. You can even roll off the roll and rest on your side. But just see if you can relax your shoulders more. Let the weight drop. All right, and bend your feet again so they're in that pushing position. Take your left hand on top of your head, not the back of your head, but the very top part of your head. If you were standing, it would be the top of your head toward the ceiling top. And keep the fingers flat, like they're a book. The hand is like a book on top of your head. The right hand is palm down still with your forehead resting. Lengthen, so you lift the right knee to lengthen the right leg in this way, pushing with the toes, and see, it's tricky to do, but can you feel, by pushing, can you feel your forehead or even the top of the head with the left hand? Push and gently feel that. And do it slowly and not too big, not too big. Can you relax and feel the blanket? Feel the blanket, how your right side slides a little bit along the blanket. And then bring that knee down, rest, and come off the roll and lie on your back. So move the roll.
So once on your back, take your knees with your hands and just feel that you could roll just a tiny bit side to side, holding your knees. And then bring your feet down. Either keep your knees standing with your feet on the floor, or you can lengthen your legs. If you really have a low back pain, I would recommend you keep your knees bent or put a couple pillows under your knees to rest in that way, all right? I'll just rest with my knees bent right now. But if it's comfortable for you, go ahead and lengthen your legs if you like. Feel the contact with the floor. Roll your head a little bit side to side. And just settling as you exhale. And the resting is a very important part of healing. There's a lot of integration that happens when we stop moving. So often the emphasis is on the movement itself, but actually the resting, particularly if you have disc issues, is where a lot of times the disc gets to get fluffed up. When you're breathing and relaxing, things might slide back in place when you're resting. So keep that in mind. And that might help you not work so forcefully in lessons, that you listen more, do less, let your body find the alignment that really is easiest. The body wants to be aligned. It's much easier if we are aligned. All right, now let's roll to your side, and we're going to come again onto the blanket roll. So you get on your hands and knees. So now take your right hand on the bottom, with the left hand on top of the right hand, your forehead resting on the left hand. Take your toes under so that you can push with your toes if you need to. And just with the left knee, lift the left knee so that the left leg is straight, okay? And usually with most disc injuries, there's one side where the disc is pushed. But sometimes the disc could be pushed front or back, and that's a little bit different lesson than what we're doing right now. I'm working more with a side issue, let's say. So try to rest your arms as much as you can. Feel the blanket roll. And very gently push so that you push that straight leg upward toward your head in that direction. But be careful that it doesn't hurt, that you move in such a way that it feels like you can rest on the blanket roll and that the whole left side can just sort of slide upward. You might even feel your forehead moving upward on your hand a little bit. Yeah, just feel that movement. And then as you come down with the direction toward your feet, the leg stays straight, but the heel kind of reaches back a little bit, okay? Go easy with this. And then rest, bring your leg down so that the tops of your feet can rest. The tops of your toes are resting on the floor. And then take a breath and relax your chest. And settling. This is super gentle. We're doing just the least amount right now, just kind of nudging the sides of the spine to connect. That's all we're doing, is a little nudging. Let's go ahead, tuck the toes under again. This time take the left hand on top of your head and then very gently, with that long left leg, you're going to gently push the toes to connect to the top of your head, and then breathe in. And then exhale, and as you exhale, take the heel downward so the long leg goes down, and settle. And then heel comes upward. The whole leg is moving upward, very gently, breathing. Exhale, just stay upward there. Exhale, settle your chest, relax. And then bring the heel downward, keeping the knee off the floor, the leg is straight.
Breathing. Good. And then let's come down with your knee. Take your hand back to rest on top of the other hand just for a moment. Gently. Feel the two tops of your feet now on the floor. And then take both feet, tuck them under, straighten both legs now. Both legs. Take that left hand on top of your head so your forehead's resting on the right hand. And just now take your left leg and move it upwards and down slowly. And just listen to the echo on the right side. So the right side is moving a little bit too. I haven't talked about the opposite side, but now leave that. Keep both legs straight, but now take the right leg and move it upward and downward. And you feel how the left one is moving a little bit because the right one is moving. The left one's moving the opposite way. But don't force it. Don't force, just easy breathing. All right, leave both knees down now. Take away the roll. And roll on your back. And just, you can have your legs standing, or if you want, you can hold your knees a little bit and just gently roll slowly a little bit onto your, little bit onto one side and a little bit to the other. Just a small movement. Bring your knees down. You could lengthen one leg and just see how that feels. And then the other leg. Don't push this if you have a lumbar issue. Don't try to straighten both legs right now. And if you don't have issues in your low back, you can lengthen your legs, but just be very gentle. If anything's pinching, we don't want to stay in a prolonged position where it's pinching. And then roll your head a little side to side. Feel the contact there. Can you feel more contact with the rib cage now, your shoulders, your hips? Do you feel way more connection with the floor, with your bones? And then let's roll to your side and we'll come up to sitting. And of course, coming up from the ground with back injury is a tricky thing. So be very careful that you go slowly, that you don't jerk or move in a way that strains. I recommend coming onto your hands and knees, having a chair near you so that you can use any support you need to come up, but coming to all fours, taking one foot on the outside of your hands and using your hands and your other foot to 3 points to push yourself up into a squat and then slowly rolling up to stand. Okay? So be very careful coming out of this to standing. And then it's always really helpful after a lesson to walk after you're done. Don't walk far, not more than a few blocks at the most, or around your house or on your street, but walking will help to integrate the tone of the core. So after most of my lessons, I recommend walking and see how this is for you. This is part of my Tree Vital Core series, working with trees and how trees teach us how to be more vital. Thanks so much for subscribing. Hit the notification bell if you want more videos, and I look forward to seeing you next time.